Hello, I'm Dr. David Rosensweet, and you are live with I Wonder Doctor. So to all of you around the world and all the ships at sea, I'm here to answer your questions. And you can call in any question that you have to 888-502-8886. And I'd like to open today by telling you about Kristen. She is not my patient. She's a patient of a Dr. Bredesen, and she was suicidal. She was 68 at the time, and what had happened for the years prior, she had watched her mom drift into a severe dementia, which was ultimately diagnosed as Alzheimer's, and then go into a nursing home and not recognize her kids for 18 years. And then Kristen, who had a very significant job in which she had to process a lot of data, read a lot, produce reports, she started noticing about 3 years prior that she wasn't remembering things, and she couldn't remember the numbers, and she took a well-trailed path into the office every day, and it was down an interstate, and she couldn't remember when to get on or when to get off, and she was calling her pets names other than they had, and she denied it for a while, and then she got really uncomfortable. She went to see a doctor. A doctor told her that she had dementia like her mom, and the doctor wrote down on her chart memory challenged, at which point the insurance company rejected her for assisted living and long-term care insurance, and Kristen wound up going to her friend wanting to commit suicide because she felt so bad. And her friend talked her down off the suicide because her friend had just heard of a doctor on the West Coast, a couple thousand miles away from where Kristen lived. And sure enough, Kristen traveled to the West Coast and entered Dr. Bredesen's program. She was patient number 1. otherwise known as patient 0, is the very first one in his protocol. And 3 months later, she was back at work, back remembering things. She could read a whole page and remember what she had read, writing reports, and she felt so good that she started periodically traveling to different parts around the world. So that's pretty wild, because we're talking about Alzheimer's here. I mean, as far as it's known popularly, there has never been a reversal or a cure of Alzheimer's. Well, that has changed, folks. And if you have a relative who's starting to have cognitive challenges, or if you've got a family history of Alzheimer's, or, here's what I'm going to recommend that you do. You get this book by Dr. Dale Bredesen, The End of Alzheimer's. My goodness, it is a complex book, and that's the good news, because so much is known. And the main thing that you need to know is that he and his team are reversing Alzheimer's. That doesn't mean just putting a hold and slowing down the development. That's called a reversal. And how great that is, because all of us have been touched by dementia. Or so many of us have. My own mother, who led such a strong life and was so courageous and so brilliant and an excellent artist. She's now 96, and she doesn't have Alzheimer's, but she definitely has it, has a form of dementia. So the great news is, like anything else, there's always causes. And for Alzheimer's injuring the brain, there's a lot of different causes. Dr. Bredesen has a list of 36 of the original, of the basics to come to grips with and to work with and to heal. So mainly, it's amazing. In my medical lifetime, I've seen Alzheimer's be a hopeless disease to he's reversed Alzheimer's in hundreds and hundreds of patients, and he's trained physicians all around this country. So if you have a relative, purchase that book, End of Alzheimer's, get connected with his network. There's so much that you can do. Now this matters to me too, because my goodness, I want to be practicing. My father practiced until he was 93, and I'd like to go to 103. Well, anyway, if you have a relative or a friend, connect with Dr. Bredesen's End of Alzheimer's. And we have questions that have been emailed to us through I Wonder Doctor, through the Ask a Doc. Again, if you have a question that you'd like to call in, our number is 888-502-8886. And here's a question from Tyler. My problem is me. I stop eating chocolate for a while, and then I start up again. I floss a lot, and then I don't floss at all. I try to drink 1 glass of wine a week, and before I know it, I'm drinking more than a glass every night. I don't want to give up on myself, and yet I seem to be untrustworthy. Help me. Oh my goodness, Tyler. I wonder how many millions of people are having a very similar experience. And I certainly have experienced this in my own life, in my own healing process, and in so many of the patients. What is the missing link there? Well, let me start with, you've got a lot going for you here. You're conscious of it. You're aware of it. My own experience with myself and with patients is that's the first step. You've got to become awake and aware to what's going on, really. And you got to be honest about it. And so, bravo that you are admitting it. Now, what is it that makes us back up on doing the right thing? And there's a couple possibilities. And one is that we have some underlying emotions and thoughts that are habits to us, and we don't know how to break out of the emotions and the mental language of the habits. And I want to address that because sometimes when people have challenges, and we all do, to our own self-worth, where there's part of it seems like there's part of ourself that is in there being critical to ourselves and being hopeless about being able to change and has actual thoughts about, I can't really change and I'll never really accomplish my dreams. That would be thoughts, and then there could be emotions associated with that, like a sense of powerless or a sense of feeling hopeless. And I love to get down to exactly what's going on in myself and in any given moment. So here's a possible practice. You have been really good about the chocolate for a week, and then you're going into that refrigerator and you're reaching for the chocolate. Well, that's your clue. You're already advanced enough to know that, oops, I'm crossing back over a line there. If you can, in that moment, instead of opening up the refrigerator, pause, sit down, and ask yourself, what am I feeling? Because it's usually the uncomfortable feelings that are the juice behind the obstacle to commitment, to doing what you know is the right thing and an important thing to do. And what you might encounter there when you're sitting down after having opened the refrigerator door, or even with the chocolate in hand and you're sitting down and you haven't eaten it yet, or even if you've eaten it yet, ask yourself, what am I feeling? And one common thing that people will encounter is a sense of actual emotional feeling called hopelessness and powerlessness. And if you're listening, imagine yourself when you're eating that chocolate after you wanted to not do it. And that's the next stage of awareness, where you become aware and sensing and feeling of something that's standing in your way of achieving what you want. And it will be a feeling of hopelessness or powerlessness or fear or something like that. And if you'll just do this, if you'll breathe and feel that powerlessness and that hopelessness, and breathe and feel it, and breathe and feel it, and I know I've mentioned this many times, you will find that you're doing an act of self-acceptance, an act of self-love. You have unconditional love. You're accepting yourself right in the midst of a feeling of powerlessness. And you breathe and feel that powerlessness, and I promise you that if you do that with any uncomfortable feelings, and you don't have any agenda to get rid of them, you're just accepting yourself exactly as you are, you will find that sooner or later that feeling's going to melt and you're going to feel relief. You've taken a hopelessness and you wind up feeling more of your real self, which is hopeful. You'll feel it. These are words. You'll feel it. And when you start developing a skill like that, and you can find this skill in our series on anxiety and depression in the I Wonder Doctor video series, you'll find me coming back to this skill over and over again. You'll find what is interfering with the motivation to keep up your commitment, because it's usually some form of lack of self-love in the moment that would lead to a decision that would hurt ourselves. Whereas if you develop self-love, well, this is the ultimate in self-love. You're doing an act of unconditional love. You're accepting yourself for the exact thing that's going on inside yourself, a feeling of powerlessness or hopelessness. You're learning how to love yourself. So there's more to this story, but that's the practice. Pause, feel what you're feeling, and accept it. That means you continue to feel it and you let it be the energy that it is. Try that one on, because that'll help you get at the root of why we do those funny things. We know what the right thing to do is, but we don't do it. We wind up feeling bad, and so this is how you break that cycle. That's one major way to do it. One other way to do it is choose not to. Oh, that's the big one. Where you simply, I'm opening up the refrigerator. Nope, I'm closing the refrigerator. Now that's a whole other level of skill, but it is that non-complex. And then you keep doing that, and what'll happen is you're going to feel good. So, big question. I love this one, Tyler. And boy, if you were to call in, I'd be able to work down into the details of how this is for you. Thank you for asking that. I'm certain it's relevant to so many people. And let's see. Here's a question for Ashley. Can I breastfeed while applying menopause hormones? Do you know? I've never been asked that question, and of course this would be an unusual situation where you've had a child and you're breastfeeding and you've gone into menopause at the same time. Here's the thing. In a younger woman, she has rich, robust levels of estrogen and progesterone and testosterone and DHEA in her bloodstream, floating around her body, in her cells. The ovary's producing it, and it does so in a steady way. And then if you are applying menopause hormones, I'm suspecting that you've gone into menopause, and I would want to know a heck of a lot more about what dosages and what forms, because if you were just bringing yourself back up into hormonal reasonableness, that would be different than some of these aggressive protocols that keep the levels up high enough for you to continue to menstruate. And just to know, it takes 3 to 8 times the amount of applied hormones than it does which your ovary would produce to keep a period going after the time of life's come when it's time for the periods to stop. So I don't know, I need to know more about you. Perhaps you'll call in our menopause section, which is at 3 o'clock Eastern Standard Time. Now, if I were to be breastfeeding and you really needed those hormones to prevent hot flashes and the doses were proper, and here's where I recommend that you go to our menopause method or to I Want a Doctor and go for Ask a Doc, that you get someone who is really skilled at this. I mean, ordinarily, estrogen, for example, we suggest that you apply it at least twice a day. There are methods where you apply it once a day, but that leads to one burst in the bloodstream rather than 2 small bursts. Well, if I was menstruating, I would do a very delicate balance of, number one, apply it after the baby had breastfed. So there'd be a time distance between the baby breastfeeding, then you apply, then you got a half hour, an hour, or 2 hours, and then by the time the baby was ready for its next breastfeed, the hormones would be better distributed throughout your body. So I'd want to know that the dosages were on the lowest end of the spectrum, and I'd want you to apply them after the baby had just breastfed. And then the third thing is I would split it up. Instead of 2 times a day for bias, for example, I'd split it up to 6 times a day. So you take the same total dose and you split it up to 6 times a day, and that means every time you apply it, you're not getting a burst into your bloodstream. You're getting just a very small amount in your bloodstream. That would help your body keep your estrogen levels and the rest of your hormone levels up to reasonableness, but it would lessen the number of spikes, because as soon as you apply it, that's when it absorbs the best. That's when the levels in your blood get the highest. So, yes, it depends on all those factors. Right dose on the low end, distribute it more times a day, and distribute it, so apply it right after the baby breastfeeds so that there's a time gap between when you've applied it and when the baby breastfeeds the next time. You would be someone I'd sure like to know a lot more about too, because this is sort of a roughing in of a situation where I love the details. I'd want to know, how low were your hormones? How was that determined? What is your symptom situation? So you can inquire more and call in to 888-502-8886 during our menopause section, which is at 3 o'clock. And then the next thing I'd like to talk about is arthritis, because here's a question from Harold who says, I have arthritis. What should I do? Is there anything I can do about it? And yes, the answer is yes. For one thing, there has never been an illness, ever, that hasn't had causes. Now, when you go and investigate certain diagnoses, and you try and get down to what the causes are, sometimes they reveal the causes, and sometimes there's a lot of causes that have been left out. So let me tell you a story. A patient went into his doctor's office in Tennessee about 50 years ago and received a treatment, a diagnosis and a treatment, and 3 weeks later called up and spoke to the doctor. and said, "Doctor, you gave me a medicine for my intestinal tract. You told me I had amoebas. I didn't hardly even feel it. But the most startling thing that's happened is I have had rheumatoid arthritis, as you know so well. For 20 years I've been in pain every single day. And the medicine you gave me, it seems to me like it has eliminated my arthritis. I have no symptoms anymore. Did you give me an arthritis medicine?" Well, that sparked a lot of interest, because this medicine that was given to this patient, its name was metronidazole, and it was there to kill amoeba. And that, what eventually we've turned up about that is, if you picture an amoeba, this is a look under the microscope, big blown up version. I'm going to pretend that my hand is what an amoeba looks like under the microscope, and you zero this very powerful microscope in on the cell membrane. There's these little protrusions of protein and lipids, and when your immune system comes in and it identifies, it looks, look at this. This is foreign. What is this thing? Well, let's make a template of it. And this is now called the antibody, and this is called the this is called the antigen, and this is called the antibody. So the immune system has made like a mirror replicate of this, and then it travels off to the rest of the immune system and says, "See this? We're being attacked by an organism that is the mirror image of this," and produce lots more antibodies so we can go tie it up. And so a lot of antibodies are produced, and they circulate, and they link up with that amoeba, recognizing it by the cell surface. And that's one of the ways that your body eliminates germs. Well, the amoeba is a single cell. You've got a lot of single cells in you. And some of those cells might look like the surface of that amoeba, or close enough that the very antibodies that were there produced to attack that amoeba were similar enough to the cell surface of, let's say, the thyroid gland, or let's say the joints. It was similar enough to joint protein that that same antibody that attacked the amoeba attacked the joints. That person you would then have an immune response in your joints. That's called inflammation. That eventually leads to chronic inflammation or arthritis. So what happened is that metronidazole knocked off the amoeba. There was no more need for these antibodies to be around. They diminished in numbers, and the arthritis quieted down. This is called autoimmunity, and there's a major form of arthritis that really is, like rheumatoid arthritis, is an autoimmune illness. And so what do? If you have rheumatoid arthritis, the best thing I can tell you is go to a functional medicine physician, a naturopathic physician, someone who has really trained themselves in their primary orientation thing is they're not trying to take care of the acute situation as much as they are is trying to get down to the causes and address the causes. Holistic doctors, functional medicine doctors, naturopathic doctors, they've really trained in this, and if you go to Ask a Doc, one of our team members will help you go to resources for where you can find these doctors. And what are they going to do? One of the first things they're going to do is do a poop test, because lo and behold, this thing of having unbeneficial critters in our gut that our body forms antibodies against is a common cause. Or it might be that some of the things that you're eating, like wheat, for example, is provoking your own immune system to form an antibody. And that antibody is like your joints, and that same antibody attacks joint protein that is there to attack the undigested wheat molecule, which can happen if you have digestive issues, or if you've got something called an intestinal tract that's hurting enough to give you something like leaky gut. Oh my goodness, what trail am I going down here? But the good news is your job is to find someone who really knows how to do this detective work, because your rheumatoid arthritis or your arthritis, it has causes. And they always come down to issues of nutrition, what you're eating, what you're putting in your mouth, toxicity, all the possible toxins that we're exposed to, and detoxification, too much or too little exercise, and then how we respond to stress. We're not here to get rid of stress, but it's more like If you're having an overreaction to stress, then you're going to really affect your immune system and a lot of other systems. So get down to the causes and get the technical help to get down to see how your intestinal tract is doing, whether you're allergic to any foods or not, or having an immune response to the foods, etc. There's causes to arthritis. And then there's one more cause to a different type of arthritis. It can become from a vitamin deficiency. Well, why in the heck would you get a B vitamin deficiency, a niacin, niacinamide deficiency, to be specific? Because there's an orthopedic surgeon who did some beautiful work with this type of arthritis that's osteoarthritis, and you didn't specify in your question to me, but osteoarthritis has these little nodules right here in this joint that is at the tip of your fingers. And sometimes it's a niacin deficiency, and large doses of niacin will take care of it. Well, if you have a niacin deficiency, likely that you have other deficiencies, so you've got to really look into how you're eating and also taking the proper amount of supplements. What am I illustrating? That this illness, arthritis, and every illness, even Alzheimer's, like I mentioned, has a lot of different possible causes. And if you go to a physician or a nurse practitioner or a dietitian who's really schooled in these, knows how to do the sophisticated testing, knows how to track down into the causes in your life, you can unravel arthritis. And as I said in the beginning of this segment today, people are turning back Alzheimer's disease, which is about as rough as it gets. All right, good question. Let's see. Here we have a question from, I get, every time after I eat, this is from George, and he's in Ashland, Oregon. Hello there, George. And George is saying, I'm 50 years old, and every time I eat, I feel like it takes so long for my food to digest, and when I lay down at night, I'm uncomfortable in my stomach, and I've developed this cough and even asthma, and I've never had asthma in my life. And yes, I know this one pretty well. I have a version of this, and one of the possible problems here is you're getting something that really the common name is heartburn. And then what is required in heartburn is what in the heck is causing the heartburn. And it could be that the acid in your stomach is regurgitating back up into the tube that goes from the mouth to the stomach, the esophagus, regurgitating up, even doing a little burning of the esophagus. Sometimes you don't feel the burn, and a lot of people do feel the burn. And that's why they will tell their physician or their family that I have heartburn. That regurgitation can occur not so much when you're standing and walking around. No. Gravity is keeping that food in the stomach. But if you lie down, all of a sudden that stomach contents, the food, the acid, has a much easier chance to creep its way up the esophagus. Now ordinarily, it is stopped by a valve, a muscular contraction of the lower end of the esophagus called the lower esophageal sphincter. It closes and prevents any reflux. You've heard that word, reflux, or GERD, GERD, or gastrointestinal reflux disease. But in some people, for a lot of different reasons, that lower esophageal sphincter can relax and allow things to come up into that esophagus. And, it irritates the esophagus. Some people have a significant amount of pain. And then some people have this situation where when they go to sleep at night and they've eaten late at night, that creeping up the esophagus occurs to the point that it even gets up here close to the voice box, which is the entrance to the lungs, and they they breathe in, and they aspirate, it's called, some of the stomach contents or some of the food into the trachea and into the lungs, and they cause burning of the trachea and the tinier tubes in there, and you can actually develop an asthma, which is really a wheezing caused by a narrowing of the air passage tubes, and that was actually began with acid reflux. And so what do you do? The first thing I'd recommend that you do is go to our video series on heartburn, because we go into a lot of detail about the various ways that this happens and a lot of different things that you can do. I've reviewed one of these recently. One of the things that you can do is raise the head of your bed. The thickness of 3 2x4s, 4 2x4s, that's 6 inches. Raise the head of your bed. Don't you're sleeping, so gravity is pulling this food, gravity is keeping the food out of the esophagus. One simple thing you can do. And don't eat late and chew your food. 3 important things that you could do. Don't eat after 6 o'clock at night, because you want to give everything that's in the stomach really a good amount of time for it to fully digest and leave the stomach and go into the intestine. Raise the head of your bed and chew, chew, chew. And go to that series in I Wonder Doctor on heartburn, because it can really help you out. Because this is not a horrible thing, and you don't necessarily need medications, sometimes medications for the short run, but most people with heartburn should be able to reverse that by doing the right thing. There's other causes that relate to heartburn, but start there. All right. So if there's not any more questions for today, until next week, you've been live with Dr. David Rosensweet and I Wonder Doctor. And if you have any questions, go to I Wonder Doctor, our website, and email us. Click on something called Ask the Doc, and if you have any questions at all, send that in to us. Or call us at this time, 1 o'clock Eastern Standard Times on Thursday, 888-502-8886. It's always good to be with you.